important thing we have discussed, errors in the prescription. What different errors we can see in the prescription and how to overcome those errors. The first error in the prescription is with the abbreviation. If the doctor is writing the things in shortcuts, then it shouldn't be encouraged because this can cause problem, this can cause confusion, this can cause ambiguity. So writing in abbreviations, writing in shortcuts is very, very problematic. So that will be the first error in the prescription. Next, let us see what is the second error in the prescription. Name of the drug. Many times what happens is we have the similar sounding names of the drugs. Like you can see in example, acidin, epidin, prednisone, prednisolone, digoxin, digitoxin, altrocin, eltrocin. So these kind of examples can create problem. So name of the drug can also cause error, can also cause lead to the error. Next, very important error is strength of the preparation. If the doctor misses the strength to mention the strength, then it is a serious error, right? Writing just paracetamol and prescribe a pharmacist prescribing a 650 mg paracetamol or 500 mg paracetamol is not good. Doctor should clearly mention the strength of the dosage form, right? Because strength changes depending on the conditions like age of the patient, right? Weight of the patient, gender of the patient, right? Many more other disease conditions and many other conditions. So this is going to change. So not mentioning the strength is also a serious error. Next very important error you can see is not mentioning dosage form of the drug. Like we have seen the example of ketoconazole. I said if the doctor mentions just ketoconazole, it is a problem because what kind of ketoconazole should I give? Should I give it in injection form? Should I give it in tablet form? Should I give it in powder form? Should I give it in ointment form? Should I give a shampoo? Should I give what should I give? So that is very, very important because same dosage form can exist in liquid form, tablet form, injection form, supposedly, or any other thing. So mentioning the dosage form by a doctor is a very critical and crucial thing. It shouldn't be missed. Please check the prescription, whatever you have in your home, whether all these parts are mentioned or not. If they're not mentioned, then the doctor is not good. I always say. Next, dose. Not mentioning the dose is also important factor, right? Because if you don't mention the dose, what is going to happen is the the pharmacist should not decide by his own that what dose should be given, right? Is usually high or the low dose should be mentioned in the prescription, that it should be consulted by the prescriber what dose should be given to this particular patient, and it should be right, what should be the frequency, even frequency should be mentioned, how many times patient should take this drug, right? Every after 3 hours, after 4 hours, once daily, twice daily, thrice daily, once in a week, right? What once in a month, how you should take అనేది కూడా మెన్షన్ చేయాలి. So mentioning dose and frequency is also important part of the prescription. If it is missing, then again it's causing a serious error. Instructions to be given to the patient కూడా ఉండాలి. If that is missing, then it can cause a problem, right? Because if you don't give the instruction, what will happen to the patient? There are many instances. I can give a lot of examples. Recently one of my student called, right? Her about her, her name is some Reddy. I don't remember exactly. She's studying from the first year. తన ఇంట్లో ఏమైంది, వాళ్ళ అక్క చిన్న పాప ఉంది, వాళ్ళ అక్క went to some coaching or something like that. Papa was taking care of this girl and her mother, and this girl is doing family, and she don't know about the drugs and all. So ఏమైంది అక్కడ, పాపకి జ్వరం వచ్చింది. She took calamine lotion, gave it as a 5 ml syrup, thinking it as a paracetamol syrup. Her justification is, sir, P250 is also pink color. Calamine lotion is also pink color. So I thought calamine lotion is P250. And she gave 5 ml of calamine lotion to a baby, 6 months baby who is suffering from fever. She don't know the instructions of the patient. So how to be given? Calamine lotion is to be applied on the skin, right? And paracetamol syrup is టు బి గివెన్ ఓరల్లీ. ఏడ్చుకుంటే ఫోన్ చేసింది ఏమన్నా అవుతుందా ఎట్లా అని, వాళ్ళ అమ్మ వాళ్ళ అక్క ఆమె ఏడుస్తాను. ఏం చేయాలి చెప్పండి మీరు యాజ్ అ ఫార్మసిస్ట్, వాట్ షుడ్ యూ డూ? Okay, rush
We
to
should
hospital. But what does calamine lotion contain? Zinc oxide,
phenol.
calamine,
Phenol.
phenol, glycerin, rose water, right? So among all
That
these things, the only problematic part is phenol. సో ఫీనాల్ ఓవర్కమ్
should
చేయాలంటే డైల్యూట్ చేయాలి. నేను అన్న ఇమీడియట్లీ అమ్మ ఏం కాదు, నీళ్లు తాగిపియండి ఫస్ట్, మంచి ఒక ½ లీటర్ నీళ్లు తాగిపిస్తే నీ క్యాలమైన్ లోషన్ డైల్యూట్ అయిపోతుంది, దాని తర్వాత హాస్పిటల్ తీసుకోపో అని. So they done that thing. Now baby is safe. The thing is, you should know what to do and what not to do. The thing is, instruction should be given to the patient. Very, very, very important. If you see small all out all out లో పెద్ద leaflet ఉంటుంది. You see, in all languages, instruction is given. What to do if it goes into eye, if it goes into nose, if it's mixed with your water, accidentally someone eat it, what happened? How to like the toxicity information is given. So all those are instructions to the user. So patients should be instructed properly how to use the drugs, right? Soluble tablet like this strain was not supposed to take directly. It should be supposed to dissolve in the tablet, in the water, a glass of water, then it is supposed to be taken, right? So you should know that instruction should be given to the patient. If not given, that's a serious error. Next, very very important error is incompatibilities. So a pharmacist check for the presence of incompatibilities, except especially therapeutic incompatibilities. Example: tetracycline should not be taken along with the milk or any milk products. నువ్వు టీటీ ఇంజెక్షన్ తీసుకొని వచ్చి ఇంట్లో పెరగన్నం తినొద్దు, పన్నీర్ తినొద్దు, ghee should not be used because tetracycline was known to form complex with the milk. So you should be careful. Or milk products, especially ఫీడింగ్ బేబీస్ ఉన్న వాళ్ళలో టీటీ తీసుకున్నప్పుడు ఏం చేయాలి, ఆ రోజు వాళ్ళకి ఫీడింగ్ ఇవ్వకూడదు, బికాస్ మిల్క్ కెన్ form complex with the tetracycline. So, ilanti therapeutic incompatibilities should be well in advance informed to the patient. These are the errors in the prescription. Not only these known errors like abbreviation, name, strength of the drug should be mentioned, frequency of the drug should be mentioned, dosage form should be mentioned, instruction to the patient should be given. All parts of the prescription and Naduta are important. Missing anything will lead to the serious error, right? Except the date and name of the patient. If you're missing anything, right? Like if you're missing gender of the patient, it will lead to the error. If you are missing weight of the patient, it is going to lead to an error, right? If you are missing main important parts in superscription, subscription, and inscription, body of the prescription, no, any mistake, it's going to cause errors, especially about the dosage forms, strength, frequency should be mentioned carefully. Okay, guys, this is about the parts of the prescription, handling of the prescription, and errors in the prescription. In next class, we will see about some Latin terms and we'll also see about incompatibilities, right? Latin terms chala easy andi konni chudandi enduku malli time waste. Next class lo direct incompatibilities chuddam. There are a lot of Latin terms you should learn. Example: pre-sibos, post-sibos. Sibos ante food, pre ante food ki mundu, post ante food ki tarvata, right? So TSP ante generally teaspoon, some important Latin terms. TSP ante teaspoon, right? Trosh, TROSH ante lozenges, right? And TOP, top ante topical dosage form. TPN ante total parenteral nutrition, right? TBSP ante it's a tablespoon. ఇది ఇక్కడ నుంచి ఇంపార్టెంట్ అండి. TIW ఇప్పుడు కూడా డాక్టర్స్ మెన్షన్ చేస్తారు ఇట్లా. ఇట్ ఈస్ 3 times a week. Doctor writing TAB tab, we think it's an abbreviation. No, it's a Latin term to mention tabella. That is tablet. Tabella is the Latin term for the tablet, right? And even many other things are there. Like suspenso means it's in suspension, right? Sumat means let him take. Summendum, let it to be taken. So there are certain Latin terms you should learn. They're important. right? Sol means it is solution. SQ is an abbreviation for subcutaneous drug delivery. SSI is an abbreviation for single scale insulin, a sliding scale regular insulin. SSRI is an example, I mean, abbreviation for selective serotonin reuptake inhibitors, right? So there are a lot of other things, right? Like sublingual, it is given sublingually under the tongue, right? SEM is seed, right? SC is subcutaneous. Even today, doctors use it. SOS is if there is needed, right? SID is once a day. Signa is writing the label, right? RX is recipe. Manam superscription antamu, right? So these are a lot of other Latin terms I will give you. You can also check. See, PM means after morning. మనకు తెలిసిందే. PO means per os by mouth or oral. PR అంటే per rectum అంటే rectal use కన్నమాట. PV అంటే vaginal use కోసం. ఓకే. Next IPBP USP, you know, short terms for pharmacopoeias. No need of these abbreviations. So ఇక్కడ
Three
చూడండి.
times.
Yeah, omnihora every day, omni bihora twice on every day, right? Inkoti omni nocturna every night, omni main every morning, right? So nocta means take the drug at night, nebula means spraying. Ippudu kuda we use term nebulizer, right? So mist means mixture, mixtura, feared mixtura ante mix well, right? So these are some examples of Latin terms అండి. Latin terms లో చదివేయడానికి ఏముండదు కానీ ఒకసారి చూసుకోండి. Latin terms లో definitely they may ask few Latin terms in the question in the paper. At least one two questions అన్న one question అన్న at least Latin term మీద ఖచ్చితంగా ఉంటుంది. So just have a look on Latin terms also, very very important. Okay, so a lot of Latin terms are given. I will give you all those Latin terms. If possible, you can go through after the class. Okay, so that's it for today. In next class, we will discuss about the incompatibilities. Okay.